Thank you for taking the time to come in and see us today anyway, and to talk about implants a little bit with us.
Yeah.
Just tell us a little bit about your story first, and how you came to practice, why you came here. And
I've had partial upper dentures for many years, basically, after sort of a few problems with my teeth, and it worked quite well for quite some time. But as sort of I got a little bit older and realised that perhaps I wanted a better feeling in my mouth and to be able to eat easier, I just felt I needed to perhaps think about actually going for implants. I'll be truthful, a lot of times when I've looked at it, I thought, well, it's quite expensive. It's a treatment that takes quite a time to do. And I think those were some of the concerns I had.
It's daunting, isn't it, as a prospect?
It is daunting. No, I don't know if it's daunting. I think it's more a case of actually thinking about, do I want to go through that procedure and that time? And I had a look around. I wasn't with originally this practice, and you were recommended through friends and other people that I talked to about having implants. I do tend to sort of do quite a bit of research on anything.
Yeah, we were talking about this just before. And we're quite similar in that. So we always like to be well planned and everything sort of looked into and know exactly what we're...
Yeah, I've been looking at electric cars for years and still for a long, long time. So in a sense, when I thought about implants, I thought, well, I want to stay local. I want to stay with someone that's been recommended. So I think probably that's the reason why I came to you. From the offset, really, with that initial consultation, you explained the options in regards to sort of what was available, what sort of time span it would take in regards to sort of how we would go about it, and the cost. So from that perspective, it was quite a clear way of actually thinking about how I was going to progress. So yeah, it's been good. It's been really good.
And because a lot of people, the things they say about a partial denture, which they don't like, it's always the things I say to people is they move around in your mouth, they can collect food around them, they feel quite bulky and affect your speech. There's also some impact on food taste, which is another element to it as well. And there's that confidence and sort of element of, feeling like you've lost teeth, and there's that sort of not psychological element, but you've got a denture in your mouth.
Well, I think it is psychological. As I was saying to you, when I worked, part of what I was involved with actually was presenting the company I worked for, and you have to be confident in regards to how you stand up in front of people and express what you're providing as information to your audience, and that all comes with actually being able to be confident and to speak well. And yes, to a certain extent, I think probably having dentures did have a slight effect on that. I did replace them probably every four years, I guess, 4 or 5 years, something like that maybe. And again, that was a cost and expense that I had to consider as well.
To keep them in tip-top condition and to be able to present to people. That's definitely true.
And I think when you're thinking about cost, to replace dentures, even partial dentures, every sort of 4 or 5 years, you have to weigh that up against having implants. And I think
especially for a compromise, I think as well, when you're taking in those facts into consideration.
Yes.
And since you've had implant treatment, how have you found the transition and the difference between the two?
Well, really well. Yes, I would say probably the first maybe month or so took a little bit of getting used to. Having really the confidence to actually say, okay, I can actually go and bite an apple, or have the confidence to crunch on something that perhaps I'd be a little bit cautious about before. Now it's, you know,
something you don't think about.
yeah, you don't think about it. It is something that actually is, it's very natural, almost like having natural teeth. And I think probably that's the best way I can probably explain how the procedure from having dentures to having implants, it's become quite a a natural experience.
It feels like you've got your natural teeth back.
Yes.
And you can use them as natural teeth.
Yes.
Yeah.
Definitely, yeah.
And I've got a question for you. Actually, I find a lot of people who go from transition from having a partial denture to then having implants find an experience at some point where they're going to try and grab and take their implants out in the mirror. Have you done that?
Yeah, that did happen. That did.
Takes a little while.
That did. Yeah, for the first sort of maybe week or so. I think probably particularly in the evening when you clean your teeth just prior to going to bed. There's always that sort of feeling of, oh, do I need to take my? And you don't. And of course, you think, oh goodness me, and it does take. It's that mindset, I guess.
Yeah,
isn't it, really?
but it's great to be able to know that you're going to take it out at night.
It's fantastic.
Yeah.
Yes, you do have to have the same sort of hygienic principle in regards to cleaning them and actually coming to see the hygienist. Slightly different way of understanding what you do with implants. Whereas you think, well, I don't need to keep them clean. Of course you do. I think it's something that is still like using it as a natural tooth. And teeth that you actually got in, then that's how I found now is how I clean my teeth. And
I always say to people, if you look after them, they'll look after you, which is true, isn't it?
Yeah, it is.
But that's the same with a lot of things, in teeth, natural teeth included, and other things. There's no doubt about that.
Yes, definitely so. Yeah.
We did obviously have some tricky points in because some sort of complex bits with the treatment as well. It was we all went through it and we got everything sorted out straightforwardly, but we managed those, I think, quite well, and you were quite happy with the communication through. I think we had quite thick gum when we were doing it, which just made it a little bit more complex for myself, and obviously a little bit more complex for you as well. But actually, even with it being quite tricky, we managed the situation. I think you'd agree, would you? Or?
Definitely. I think what actually you explained in regards to sort of the whole time plan and how you would approach it, and it was really quite interesting from the point of view that well, a lot of things really. From a technical point of view, I was quite interested, as I could see you are, in regards to sort of how
I can talk for hours about teeth.
And how advanced the whole process now is with the scans. And I was quite amazed how sort of the ability to be able to get that amount of information from all the gums, the existing teeth, and the best approach, and also the areas where it could be a little bit difficult to actually progress the implants. So that all actually built a lot of confidence in me in regards to how you were going to approach it. And by having the confidence, then that relaxes me in knowing that the treatment, I wouldn't say it's without its sort of demands in regards to sort of having to go through that process. But I think your skill in regards to how you approached it, the way in regards to how you planned the process, and how you actually worked from the start to in actually having the implants sections in, and then actually finally fitting the caps and the mechanism, if you like, of actually progressing that element
and being guided through the whole process.
It was
because it's very. I think patients struggle with the process actually, and without that information, and without if you've got a question, you're not feeling that it's been dismissed or you've gone over that. If I can explain to you why, what, how, show you on some models, show you on some photographs what before and after is going to look like, and also then give you some information to take away. It means when you come, you've got that confidence that actually I'm not worried about the what, when, how, who, what we feel like. And you can just concentrate on actually just doing the healing bit and enjoying your life and having everything as it is in the interim.
You're right. I think it's about actually having the treatment that you know it's going to take a while to carry out, but also to be able to understand the process. And I think understanding the process, you can accept the fact that it's going to be a bit uncomfortable at times.
Yeah.
And I think by understanding that process and knowing that discomfort's going to not going to be there for very long, but it's a process you're going through.
Yeah.
That the end result is right.
Speaks for itself.
Speaks for itself. Yes.
Yeah.
Yeah.
Lovely. Thanks, Ken.